Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to go ahead and welcome everyone to our weekly news conference for the latest in COVID-19 information for the Amarillo community. We usually do these on Wednesdays, but as you can tell, this week we're doing it on Friday. Let me go ahead and introduce who is on our panel today. We are joined by Amarillo Mayor Ginger Nelson, Casie Stoughton, Public Health Director for the City of Amarillo, Jared Miller, City Manager for the City of Amarillo, and Dr. Scott Milton, Public Health Authority for the City of Amarillo. We're going to turn it over to our panel to make brief statements, and then we will take questions from our media. We'll go ahead and start with Amarillo Mayor Ginger Nelson. Mayor, how are you this morning?
I'm well, thank you, Dave, and thank you to everyone who's watching. You'll notice a change this morning in our press conference. We're all wearing masks, and most of us are sitting either in an office space or somewhere where we're distance from people, but we feel like today that it's very important for us to show you that wearing a mask makes a difference. So we're doing it as an awareness. But why are we doing that? Because our hospitals are in such a desperate situation. We must make a change, and we believe that masks are integral to making that change. I want to talk to you as citizens about what's coming for us. And pardon the crudeness of this, but capacity right now. What's coming for us as a city? Halloween is going to increase our exposures. Thanksgiving is going to increase on top of those increases. Christmas creates more increase. New Year's. So over the next 6 weeks, we have multiplying factors that will increase the number of COVID cases we have in our city. And why is that important? Because remember, our hospital is already full. So we as citizens need to understand the realities of where we are right now. We have full hospitals, and we're facing the next 6 weeks of more temptations and more opportunities for spread than we've had since this epidemic began. What do we need to do about it? Well, I heard an analogy this morning that I think is really good. This virus is like a race car. It cannot just stop on the dime. So we are already at a point in our community across the Panhandle where our hospitals are at capacity, and we cannot just reverse that on a dime. But what we do need to do is focus on the things we can do to shift the trend. And we've got to take those actions quickly, seeing what's coming for us on the calendar. So leaders, we need your leadership. If you're in a position of leadership, if you own a business or you lead an organization, I'm asking that you would ask the people that are interacting and meeting with your business or in your organization that you would require them to wear masks, not for themselves, but for the sake of our entire city, for the sake of others that they're around, for the sake of our hospital capacity. I'm also asking that you would avoid groups. How can you structure your organization so that it does not require groups of people to meet in person? Those are the two main things that we need to change right now. Wearing masks properly and not meeting in face-to-face groups. And then I want to address the citizens, not just of our great city of Amarillo, but the citizens of the entire Texas Panhandle, because these hospitals are your hospitals, and everyone's choices are impacting whether or not all of us will have emergency medical care when we need it. And that's not just COVID patients. Those are stroke patients, heart attack patients, cancer patients. Those are all different types of medical needs that are having their access and capacity limited, as well as their medical providers' fatigue when it comes to addressing their healthcare needs. So what do we as citizens in the Panhandle need to do. First and foremost, I'm asking you, but wear a mask for the good of those around you, to protect those around you. We don't know who this virus will attack, who it will have an impact on that they would need to go to the hospital. It's difficult to predict that. So I'm wearing a mask because I don't know who I'm going to come in contact with that the virus might affect them in that way. And I'm asking you, as a citizen of the Texas Panhandle, please wear a mask for those around you, and especially for our hospitals. Wearing a mask is the most important thing we will do to help our hospitals return to a capacity where they can manage taking care of need to be hospitalized. I'm also asking you to avoid groups as much as possible. Please don't go to social things unless I can't even think of why it would be required or needed at this point. For the next 6 to 8 weeks, we have got to pull back on our social gatherings. And I know, let me just say, I know everyone thinks, well, this is just me and my small group of friends. That's where the spread is happening. It's not a hot spot. It's not school even. It's happening when people let their guard down for just a minute and do one small thing. It's happening when kids jump in the car together and go to lunch. It's not happening at math class. It's happening when they let their guard down and they leave campus to spend 30 minutes together for lunch. That's when the spread is happening. Same thing in the office setting. When people sit down to have lunch together, take their masks off, spend time together closer than 6 feet over a meal. That's where the spread is happening. So please change your events. Don't have them without masks, and don't have them where people are eating or drinking together. Best case scenario, all the way through the holidays, we would do things virtually. And if you, as a citizen, if it's important to you to go to church, then make that the one thing you're going to do. But pull back in other areas. Don't do socializing with your friends. You'll have to change your traditions from what they normally are at the holidays. And we understand that. I understand that. And I grieve that with you. But we must make these changes, or else our hospital is going to be in such a desperate situation like we've never faced before, ever in the Panhandle. So what's not helpful, just a little reminder, look for the silver linings that we have here. I know we're all changing our expectations. We're changing our behavior. It's different this year, but it's not that way forever. The choices that we make right now for a temporary, fairly small period of time can make a huge difference in how our community can handle this situation. And I want to ask you to please work hard to look for the positives in this situation. I'm not saying it's easy, and I do know it's tiring. It's hard. We're in like month 8 of fighting this pandemic, and we wish it was behind us. But I'm asking you, fight just a little longer. Remember that your words have power. So in that moment of frustration, when you rail out against having to wear a mask or whatever it is, it's affecting the people around you. It's affecting the children that hear you say that. Choose to say something positive. Choose to talk about the things that we're gaining as a community by pulling together. And work hard to curb your frustration. We all have it, and we all have to work hard at releasing it in an appropriate way. I think a good way to curb frustration is to focus on gratitude. And you can start by thanking the hospital workers that you know. Send a note, bake a good, something that you can do that shows them gratitude. They're tired and they're working so hard for us. us, and the end is not in sight for them. I know that we will do what we need to do, but use the power of your encouragement to give gratitude and fight frustration. And I think that'll make a big difference in our community. Thank you, Dave.
Thank you, Mayor. Let's now go to Casie Stoughton, Public Health Director for the City of Amarillo. Casie, how are you today?
I'm well, Dave. Thank you so much, Mayor Nelson, for your words. Just want to review the numbers, and then we will talk about another couple of items. So as of yesterday, there were a total of 13,423 total cases of COVID-19 in Potter and Randall counties, 8,096 cases in Potter County, and 5,327 cases in Randall County. We're excited about each and every recovery, and we have 9,719 recoveries, and we're sad at each and every death, and there are 159 deaths reported in our community. That leaves us with 3,545 active cases here in our community. We're averaging around, like, our 5-day average case rate is around 200 new cases per day. That's a lot of cases. The GA32 hospitalization rate, so we've been over the 15% hospitalization rate that the governor's, the threshold at 15% that the governor set for us for 13 consecutive days now. Yesterday, that percentage was 27.42%. Our hospitals are at critical capacity. The hospitals are critically full. The dashboard at AmarilloAlerts.com has information that's updated every day that you can check to see that information, but our hospitals are very, very full. We can all be part of that solution. It reminds me of a tug of war. When we were little, we played tug of war, and this fight right now reminds me of that tug of war, where we've got COVID-19 on one side, and we are everyone in our community is on the other side. But in order to win that tug of war, we have to wear our masks, we have to socially distance, we have to do all of those things that the mayor said. And we have to do all of those things together, or we will not win that tug of war. And we have to win that tug of war because we've got hospital workers, we've got nurses, we've got respiratory therapists who are working so hard to care for us. And it doesn't show that we're caring for them right now. And so we've got to work hard, and we've got to pull together to win that tug of war right now. And so as the holidays are coming and we're looking forward to those holidays, let's pull together so that we can win that tug of war against COVID-19. And I look forward to hearing what Dr. Milton has to say today. Thank you, Dave.
Thank you, Casie. Let's now go to Milton, Public Health Authority, Texas Tech University Health Sciences Center. Dr. Milton, how are you?
I'm fine. Can you hear me, Dave?
Yes, we can.
Okay. Well, this morning, I'm actually in the middle of the COVID unit of the MICU at Northwest Texas Hospital. And I have a very special guest here who is the charge nurse of this unit. Has been in charge of this since March, and we've had some very heart-to-heart discussions over the last several months concerning the care that we're trying to give these patients and trying to take care of ourselves at the same time. So I thought it might be helpful for have Leona just also give us a plea here of wearing our masks and being responsible citizens. So I'll just let her step in and say a word.
Hi, I just want to say thank you for giving me this opportunity to talk to you all. We are struggling here at the hospitals. Our hospitals are getting full of COVID patients at this time. Our ICUs are getting full. And I just seriously beg and please, 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 our community needs to be following the standards that the mayor has put forward. It's not about living in fear. I know we hear so much about that. It is not about living in fear. It is about simply living and being able to have the next holidays. We may not have the holidays this year, but we will, if we can survive through this, we will have them next year. So I just beg and plead, please, for our community, wear your mask. I wear an N95 mask and a surgical mask for 12 to 14 hours a day. It's not comfortable, but it's doable, and it means that we can survive this. So please, 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 Amarillo, wear your mask. We beg of you here at the hospitals, wear your mask. Thank you.
Okay. As Casie has alluded to, the numbers are not pretty. And I think the mayor and Casie have said that very well. This morning, there are 100 patients here hospitalized at Northwest. I haven't heard from Dr. Lamentier at BSA, but I know yesterday that were 120 patients, and it was up close to 130 with a later message that he sent to me. And those numbers have continued to go up. And we don't expect them to go down anytime soon. So there's a critical stress here on the availability of beds. They're doubling up on the beds in both hospitals and trying to cohort COVID patients to 2 to a room now. I think that ICU beds are becoming critically precious. We still have some. And I guess the other question that maybe some of the viewers will be asking, well, how does that really affect me? Well, now we don't do elective procedures here at the hospital. And for example, so other things that happened that may be really important, you won't be able to get done in terms of procedures. I had a conversation with a neurosurgeon yesterday here in the hospital who was worried that he would not have a bed, an ICU bed for his neurosurgical patients if they had a trauma or if they needed surgery. And so these are the kinds of problems that we're going to start running into, is just the routine things that all citizens tend to believe that we have here and take for granted in terms of what we can offer here at these great hospitals. Those resources are being stressed to the point to where it's going to be difficult to do in the weeks ahead to try to do that. So what can you do? As I've said before, and we've said many times, wearing a mask does make a difference. As we've said before, it is more likely to catch COVID outside the hospital than it is inside the hospital. Why is that? It's because we all wear masks in the hospital, and the likelihood of spreading it around between us in the hospital is much less because we're compliant with that. So there's proof right there that wearing a mask does make a difference. I think going forward over the next 6 to 8, maybe 12 weeks, it's going to be a rough period of time. And I would just once again beg everyone in the community to please be thinking of the people here in the hospital and be proactive and wear a mask and be responsible. And that's all I have to say, Dave.
Thank you, Dr. Milton. We'll now go to Jared Miller, City Manager for Amarillo. Jared, how are you this morning?
Good, Dave. Thanks. Some of the things that I've been saying for some time, then I'm going to go over some operational changes that we're going to make here at the city over the course of the next 3 weeks. Right now, just want to remind everyone that the drive-through testing center remains open. If you feel sick and you have symptoms you think might be COVID, call the public health hotline at 378-6300 to be screened for the drive-through testing center. Also, if you're screened for the drive-through testing center or referred to the drive-through testing center and need assistance with transportation, Amarillo City Transit, free transportation for people who have been referred to the drive-through testing center. To take advantage of that, call Amarillo City Transit at 378-3095 to arrange this free transportation. Now, the governor's executive order, GA-29, refers to face masks. And it does require that everyone wear a face covering over the nose and mouth when inside a commercial entity or other building or space open to the public, or when you're in an outdoor space where you can't separate social distance. So bottom line is, just like every single person has said, and like the governor is saying through Executive Order GA-29, it's on all of us to be wearing a face mask, to be wearing a face covering. And that's why we're doing this right now, as the mayor said earlier. With regard to GA-32, the governor's current executive order that addresses openings here in the city of Amarillo, we have, as an area of high hospitalization for the last 13 days, we are not allowed to take advantage of the 75% opening that is allowed through Executive Order GA-32. So there's no occupancy limit for the same things, essential critical infrastructure, religious services, local government operations, things like that. There is every business that was previously allowed to be open at 75% is now restricted to 50%. So all other businesses in the city of Amarillo are limited to 50%. This includes the things that are already at 50%, like indoor and outdoor professional, collegiate, and other similar sporting events. So we're at 100% for essential critical infrastructure, 50% for everything else. And then the other thing that's affected by GA 32 when we go to an area of high hospitalization is that our bars are no longer allowed to be open. They're now closed again. Now, there's going to be some operational changes over the course of the next 3 weeks to be able to assist our community and our organization with limiting exposure and making sure that we don't transmit coronavirus in every way possible. So with regard to the city organization, over the next 3 weeks, we're going to begin reducing face-to-face interaction with both each other and with our citizens. We're still going to provide all of our services. We're still going to provide virtual opportunities for permitting, for paying utility bills, things like that. We're still going to provide curbside service at the libraries. So they're still going to be open. But we will not be open to the public to go inside the facilities. Same is true with our Sims building, where we have a lot of permitting operations, and our and our community development facility, as well as City Hall, where we have utility billing and some other things like that. Our public safety facilities, like the fire departments, the fire stations, and the police department, will have limited interaction. Obviously, people are going to still need to be able to come to those facilities to report an emergency or to respond to an emergency. But we're going to have extremely limited interaction at those locations. We're going to be phasing this in over the next 3 weeks. This will also include our sports facilities at parks, as well as our civic center. So by December, we will be very restricted on activities, functions, and face-to-face interactions over the next 3 to 4 weeks. So if we will be putting out through social media and other methods, all of these things, when they're going to take effect, how they're going to affect people, and how they can still receive services from the city. We're still going to maintain all of our streets, all of our water and wastewater crews, all of our alley cleanup and solid waste functions. We're still going to be doing all those things. We're just going to be being very aware of our own masks, of our own social distancing, and also we're going to take every step possible to safeguard our community as they're receiving services from the city. So with that said, that's all I have, Dave.
Thank you, Jared. Now I'll open it to questions from our media. Let's start with Morgan Durden from KVI Channel 7. Morgan, how are you?
Hi, good. How are you?
Good, thank you.
My first question, I would Dr. Milton kind of touched on this, but when we talk about the high hospitalization rates, full hospitals, I kind of want to talk about what is the impact that this can have on the average person. Are we going to come to a time, those tough decisions where maybe someone might not have a hospital bed? Are we going to get to that point? Kind of what is the impact on the average person?
Well, right now, at this very time, if you had to be hospitalized, we could accommodate you. We have, because of the stress on the ICU beds, if you had to have procedures that were very complicated or complex and required an ICU bed, things would be stretched. I think we could still accommodate you at this point. If things worsen, which they don't seem to be getting better, then all these kind of questions come into play. Now, another thing I think that's important, and something that I touched on earlier in the week, is that we're doing still fairly well with ventilation and ventilator use. Somewhere between 50 and 60% of our ventilators are currently being utilized. That's only because the hospitals have been able to procure other ventilators from the RAC and their own corporations, I believe. However, if this continues to worsen, then you start talking about whether we would have enough ventilators for people that really needed them. And as you can imagine, that puts everyone in a horrible situation in terms of the patients and their families and the healthcare providers who have to try to make a decision whether a ventilator should be utilized for one individual or another. We're not to that point yet. We're doing everything we can to avoid that. So those are the things that I'm worried about most in the future. Right now, because of the governor's orders, and I think appropriately so, elective procedures have been curtailed at the hospitals. So if you have a need for routine procedures, whether that be a scheduled surgery or other type of procedure that's done here at the hospital, those things in all likelihood will be delayed. And obviously that's not good either, because trying to determine whether something is elective or not is a difficult decision in and of itself. Some people can have their health impacted if they don't have their procedure done sooner than later. We talked about individuals who may need a surgical procedure so they can start their chemotherapy, etc. Those things can't be delayed that long. So I think there's lots of different ways that this can impact the average person who's not sick right now. Certainly, if you have a car wreck and you needed to come in and be hospitalized for that, if you were badly injured and had a head injury, as mentioned with my conversation yesterday with the neurosurgeon, we start worrying about having enough space for those types of individuals. Does that help?
Yes, that does. Thank you. And then my last question, how would you suggest people celebrate Halloween? You talk about you don't want social gatherings and things like that. What are some suggestions for the public to have this holiday?
I think, those simple public health measures that we've been stressing time and again should be viewed as the vehicle to get us through this. So wear a mask with whatever you're doing. Outdoor activities are better than indoor activities. Try to avoid congregating in groups indoors. Wash your hands. If you're ill, try to confine yourself to a portion of the house and maybe close the door if possible, to try to isolate yourself from other individuals. So I think it's those kind of things you have to keep in mind.
And I would also add right there that the CDC has very easy to find. If you just type in CDC Halloween, you'll find the CDC's website, and it gives steps to take to have a safe Halloween. Activities that are high risk, how to reduce the risk of common Halloween activities. But that can all be found at the CDC.gov website.
Yes.
That was it. Thank you for your time.
Thank you, Morgan. Let's now go to Aaron Langston and KMR Channel 4. Aaron, how are you today?
How are y'all?
Good. How are you?
Pretty good. First question is, has there been any communication with the governor's office concerning maybe further restrictions as our hospitalization rate climbs? I know us and Lubbock and El Paso are just keep climbing even with the restrictions. Has there been any conversation to possibly restrict those more?
We've had conversations with the governor's office to coordinate resources, to coordinate, and then also with the RAC and other state entities to coordinate additional personnel and personnel requests from our hospitals. We've also been having conversations with them so that we can be ready if and when we need to stand up an alternate care site and assets like that, or to expand an alternate care site, something like that. We have not had any conversations, and the mayor would be the right person to expand upon this, requesting additional restrictions beyond what we are triggering by being an area of high hospitalization.
Yeah, I think it's a very good question, Aaron, and I think it's one that I'm hearing out in the community. What I would answer to that is, if we know something is the right thing to do it, why do we need government to order us to do it? I don't think we do. And if you didn't watch on Monday night, there was a group of doctors on a local TV station that did an hour-long interview about the staff hospital capacity is and what we need to change in order to turn that around in our community. The facts are the facts. Wearing a mask is scientifically proven to protect others. I'm not talking about protecting you. I'm talking about protecting others. So if we know the right thing to do to protect others is to wear a mask, why do we need government to require us to do it? We should choose to do it because we want to take care of each other. I think that it is difficult to envision how closing down stores in our economy actually slows the spread of the virus. If people would just choose to limit their own behavior by wearing a mask and not doing social gatherings, that gets us there. So why would we be looking for the government to do shutdowns when just people making those two simple choices can get us where we need to go? So I'm not requesting the governor to do anything differently right now. I'm requesting us, the citizens of the Panhandle, to do the right thing.
Alrighty. And have we seen more cases coming from the local schools in the past week or so?
You know, anytime there are groups of people together, then we do expect cases. So we have had, you know, we do continually have trickles of cases from the schools, and you can see those cases at AmarilloAlerts.com. We have a map there that has the cases by schools, and we have, so you can click on the campus. It's a really neat map, an interactive map, where you can click on the campus and it will tell you at that particular campus the total number of cases and the total number of recoveries for that campus. And it's a neat map.
Alrighty, thank you. This is hospitals related. How close are we to needing to expand to outside hospital care facilities?
Well, I would have to speak in behalf of Dr. Lamentier and Dr. Weiss. Obviously, we're doing everything we can to avoid that. I think that based on the in-hospital census, we're running about 30 to 40% now, probably of the percentage of people that are actually hospitalized, the percentage of those that are actually COVID patients. You know, that's getting worrisomely high. I've had some discussions with, you know, Jared, et cetera, about the need to dust off the plans of having alternative care sites. So those plans have been discussed for quite some time. Clearly, that's the last resort. Trying to set up a field hospital and do as well in a setting, in that kind of setting, as opposed to the two hospitals we have here, I think is fraught with all sorts of problems, and would if we have to do that, we'll do that. But clearly the desire here would be to bring in more staff if we needed to from the outside the Panhandle, and try to utilize our hospitals to the maximal capacity.
Alrighty, I think that has me covered for today. Thank you.
Thank you, Aaron. Let's now go to, if I'm not mistaken, Kevin Welch of KFDA News Channel 10. Kevin, how are you today?
Good, Dave. Thanks. Dr. Milton, can you tell us, did we get any more RAC personnel or equipment in the last week?
Well, Jared may be able to answer that as well. Once again, I'm trying to speak on behalf of Dr. Weiss and Dr. Lamentier. They are constantly in communication with the RAC, and I think the RAC has been a godsend in trying to continue to give us staffing and other resources. So I think that's just an ongoing, constant communication to get more help. Now, I would also say that even facilities here locally, I know have donated beds because just give us more physical beds in the hospitals, and very appreciative to those other facilities that are stepping up and helping if they have us extra resources.
And I think the simple answer on have we received extra resources over the last week in the form of personnel and nursing and things like that? Simple answer is yes. Don't have the exact numbers. I know we had 92 personnel coming in at the very start of the week, early on in the week. And I don't know if we've gotten additional personnel since then. Complicated that some, but we can definitely get that information for you through Drs. Lamentier and Weiss.
Great. Casie, the new case number yesterday was a little bit surprising in that it seemed like a one-day number, but we skipped a day. Is there a lag in the reporting on that?
Yes, that the snow day. So our staff we're catching up with the data entry due to the snow day.
Okay. And I don't know if anybody up in here can answer this exactly, but when outlying hospitals have cases and they have to go somewhere else and not to Amarillo, how does that work? Do they come to Amarillo and go somewhere, or do they go straight from that hospital? And how are they transported?
Well, I think that decisions are made at each individual hospital of what the needs are of that individual patient, and then a decision and a search ensues of where you can find that resource, and so patients are transferred accordingly based on those particular needs of that individual.
Okay. And Casie, how are the drive-through numbers trending? I don't need exact numbers, but are they steady or?
They're generally steady, but higher than they were over the summer. So, over the summer, we were seeing around 25 patients a day. Now we're consistently seeing around 100 patients a day.
Wow. Okay. And as far as contact tracing, I know that you were struggling. Are you catching up now? Because I know people still that have not been contacted 2 weeks after.
Yeah, so we're still working on that backlog, and we're making plans to bring in additional staff.
Okay.
And I think some of our additional staffing is going to come by repurposing some of our own personnel as we reduce some of our operations to reduce face-to-face contact with both the community and our own staff. We'll be transitioning those personnel whose workspaces may slow down to the point where we can spare them to public health, and they'll assist with contact tracing and other things over at public health as well.
And the steps are quite simple. So even if you haven't been contacted by public health, the right things to do, if you're positive, you need to stay home for at least 10 days until you're in, and then if you're symptom free for 24 hours. At the end of that, then you need to then you can return to work, but you need to stay isolated for at least 10 days. And then if you're exposed to someone who's positive, you need to stay home and stay isolated for at least 14 days. And I think it's really important for employers to know, if you have employees who have been exposed to someone who is with COVID-19, you want your employees to stay home. So let's make it easy for employees to stay home, because you do not want an outbreak in your own workplace. And so the right things to do are, if you're positive, stay home, and if you're exposed, stay home. And so even if you haven't been contacted by public health, those are the right things to do.
And I think that also to your question about, some people have, been 2 weeks out without being contacted by public health. We're very good at contacting everyone when they've gone through the drive-through testing site. That's our highest contact percentage, because we know all the information about those patients. We have a good protocol with the hospital to be able to follow up on testing.
Yeah, you okay?
At the hospitals.
Good.
Protocols in place to be able to require clinics and other doctors' offices to report those tests to us, but sometimes that communication does not happen, or it happens with inaccurate information. So there are times where either we don't have the information, or the information we have isn't correct. So in those situations, those people will not get contacted unless we can find or create correct information by doing other means of methods of research to figure out who they are or how to get a hold of them. So all that to say, there are scenarios where we won't be able to contact someone either because we don't know about them or because we have inaccurate information. In those situations, and the reason why Casie was sharing, here's what you do. If you've had a test taken, whether you know the result or not, if you've had an exposure, whether you know the result of that exposure or not. So we want to make sure that, one, that we're contacting as many people as we can, as quickly as we can. But in the event that you don't get contacted, we want to make sure that you know what you need to be doing to keep yourself safe and your family safe and your neighbors and community.
Makes sense. So is it kind of a matter of trying to build a system while you're under pressure?
Well, it's the whole system. So it's not just public health trying to build the system. So like Jared said, I would say we're able to contact 100% of the drive-through tests, the people who come through the drive-through, because we know that we're their provider, and so we need to contact them and let them their test results. People who are tested at outside clinics, their doctor's offices, maybe the pharmacy, different places. There's so many opportunities for testing that provider would let them know their test, but sometimes they don't report that to public health for sometimes a long time. And it may even be after that 2-week time frame. And then sometimes there's even testing capability where it doesn't even print out a test or like a test report. It goes to an app. And so there's so many variables in the system that it's like trying to hold the water in your hand. And so it is our goal to call everybody, but like Jared said, there's just so many variables that if a provider doesn't send us the lab report until 2 weeks out, that might be a situation. Or if we don't get a phone number or an address, that can be a situation as well. So we try to make contact with people. We call those providers back and we try to gather all the information, but we do call everybody who has come through the drive-through.
Makes sense. Thank you all.
Thank you, Kevin. At this time, this concludes our questions from our media. Also concludes our weekly news conference. We will be back again next Wednesday at 11 a.m. I want to thank all of our panel members who took the time out to join us today and provide this information to the community. Thank you very much. This is David Henry. I'm the communications manager for the City of Amarillo. We will see everybody.